Hello, my name is Linda Mackinson, and I am the Director of Practice Transformation Institute. Practice Transformation Institute was founded in 2007, and we are based in Southeast Michigan. We are a nonprofit organization that provides continuing medical education and IACET-accredited learning programs for implementing the principles of the patient-centered medical home and other primary care transformation initiatives. PTI empowers physicians, their medical office teams, and the greater healthcare community through training programs that are customized to fit each client's needs. Our value proposition is to prepare, transform, and improve, which stands for PTI. We are here today to discuss with Mercy PHO, Mariana Webb, the Executive Director for Mercy PHO, and with Nancy Mason, the Practice Manager for Mercy Family Care, how they prepare themselves to be validated and get ready for a patient-centered medical home validation visit.
Mercy PHO is a physician hospital organization in St. Clair County in Port Huron, Michigan. We're tied to St. Joseph Mercy Hospital in Port Huron.
This is a practice that has been designated for 3 years in a row as a Blue Cross Blue Shield of Michigan patient-centered medical home. Nancy, if you don't mind giving us an overview of your practice, that would be great.
I would love to. Thank you, Linda. We have two physicians in the practice, Dr. Camara and Dr. Lambrecht. We have actually been at this location for 4 years, Dr. Camara being with us actually 11 years now. He was alone in a practice previously to moving here, and then we've added Dr. Lambrecht just 4 years ago. It's a busy practice, seeing about 1,000 patients each month, actual patient visits. In addition to those visits, we see another, on the average of 200 nurse visits each month, so very busy. We have the equivalent of 9 full-time staff members. We have 3 in the back in the clinical area with a lead. One of the 3 is a lead. We have 3 full-time staff members in the front, and then we have an outreach specialist, which I will probably get into later, an important position that we've added since we've started working on the patient-centered medical home.
Next, what I just wanted to do is talk about how Mercy PHO worked with the practice to get them ready for a validation visit. So I'm going to turn it back over to Mariana and Nancy to discuss their process and what they had to do with their practice.
First of all, it has been an ongoing process in the practice. The PHO staff is here quite often in terms of doing various education pieces. So we've done behavior change workshops, we've done asthma workshops, we've done all those education pieces that are so vital to creating a team. And plus we do a monthly primary care learning collaborative where all of our primary care managers come, and leads, it's not limited to that. And so when it came time to do the site visit, we actually did a pre-site visit.
Okay. All right.
So we came in, Jennifer and I came, and we reviewed all of the pieces that we had validated that the practice had in place, and just reviewed with the entire staff. How comfortable are you with knowing this, really knowing this, not just having it be something written in a book.
Mm-hmm.
The PHO and us have worked together to try to prioritize and try to understand what this change is going to entail. What is a patient-centered medical home, and how will we have to evolve with that?
Mm-hmm.
And so over that period of time, I'm so appreciative of the PHO partnership because they kept us moving and kept adding new resources for us.
So did the two of you work together to review what you had in place to make sure, I'm sure beforehand you did that,
Yes.
and then before the site visit came, that you
Right.
looked at that piece to see. And then how did you involve your office staff in that piece and getting them ready?
I have to say, when I first read the measures that we had to, the requirements for the patient-centered medical home that Blue Cross put out, there were several that I really wasn't sure I was interpreting them
Correctly.
correctly. So, Mariana, of course, we worked together to understand exactly what you would be looking for in that audit. The most important priority here is you have to have physician buy-in,
Yes.
because you'll never get the staff seeing their responsibility in this if the physicians aren't supporting every move and every process.
So you had them as your champions. They were
So
true champions
They
in
were
the process
true
here.
champions.
And I remember that they were involved in a validation visit. They actually took time. They closed down their schedule, and they came in to be part of it. So it wasn't just relying on you and on the
Exactly.
PHO. They were part of the validation visit. Now, when you had a validation visit, when actually somebody came out to your practice to do a validation, what did you learn from the validation? What was helpful with the validation? What would you say led you to the next level to help you keep on moving and completing more of the tasks and capabilities that needed to get completed to keep moving towards being a patient-centered medical home?
Before the audit, there was a lot of anxiety in the office. But
Normal.
Normal, uh-huh. But I do know that there was also a confidence level, because we had put so much effort in training the staff and educating the staff and in reviewing the measures,
Okay.
that we did have that confidence that we had done what we needed to do.
Okay.
But I guess I was very pleased to find out that during the audit, it was not punitive at all. It was
Good.
very educational and very enlightening, and so I saw that as a truly positive experience.
Did they become a champion of certain things and help get ready for the validation visit? Did they work with you on that?
They certainly did. As we were going over the measures, it really, we've always known you have to have every member of this team buy in. They have to want to make us successful. And so that requires so much education, so much communication. Our physicians, being very much committed to this process, were a part of every single staff meeting that we had. And we would make sure that we had routine meetings. Now, we would have a monthly staff meeting where the whole group gets together with the physicians, but we would also have weekly meetings with the leads to say, this is our focus, this is a void, this is where we need to put more effort.
We have the two physicians of the practice in with us, Dr. Kamara and Dr. Lambrecht, and they're going to share their thoughts and feelings about the validation visit, the site visit process, and how they felt.
As far as starting up with the PCMH process, I was very excited to do that. I had already been doing some pieces of that at a previous practice before I joined this practice.
Okay.
So I was already open access scheduling and doing some of the other smaller pieces, and really found that to be beneficial for myself and my patients. So for me, it was exciting to be looking forward to starting the process, even though there's a lot of change and stress involved with the staff. It's a good process in the end.
When they first approached me about it, I was also very excited because I thought it was going to be a great addition to the practice. But it was also a very daunting task when we started looking at all the requirements that were needed, and it became kind of a shocker. How are we going to incorporate this into the already busy day? But once we sat down and did our homework and worked on it, we figured out processes, and those processes became very smooth. There were some bumps in the road, there's no doubt about that. But overall, when I take a step back and I look at where we were and where we are now, our practice has improved with providing health care to these patients tremendously. The growth, it's interesting, we're getting patients from an endocrinologist's office because they hear we're a patient-centered medical home, and they want us to manage their diabetes.
That's wonderful.
So we're seeing a tremendous growth from where we were to where we are now. And I've seen my practice, is how I'm practicing medicine, has changed dramatically since this has all begun. And I think that's a great thing. Some physicians may think that it's a bad thing because of that, but it points out where weaknesses are and how we practice medicine and how we can improve that. And you know, the outcomes that we're seeing when we're doing our data, our logistics are phenomenal. It's showing us that.
The capabilities listed that would be required for a validation site visit for the PCMH program, did that help you to be focused on what you wanted to look at, or did it just roll into part of your concept of what you were doing for the patient-centered medical
I
health?
think it helped us to better define where we wanted to start and which things we wanted to work toward,
Okay.
and also to come up with a system that we could develop to make changes in the future.
Okay.
You know, we were able to find a system that worked for us in terms of how we define these processes and who we pinpointed to make those changes or to lead those changes within our practice. I think it really has opened up a lot of discussion with the staff, and we found out that they're pretty bright people and they have great ideas, and we've been able to utilize quite a few of their ideas in making this change happen. I think the guidelines or the requirements for the validation appointment or the validation visit, they just help you to kind of keep looking forward. You know, every year it's kind of, well, we did this, now we're going to work on that, and keeping your mind open to what's coming next.
It aligns us to prepare for what's going to be coming up, and it gives us a better, it lets us open up and open the books and say, okay, what have we been doing wrong, what have we been doing right, and where is it going?
Where's it going? How was that experience that you went through? Did you see for the areas that maybe didn't get the validation credit at that point, did it help you then to grow to another? Did you understand why you didn't get the credit?
Yeah,
the
absolutely.
Credit for it?
Yeah, absolutely. We did. I mean, the volumes of paperwork that we have when we sat down for that is incredible when you look at it and you take a step back. You look at all this stuff for this validation, but it's an eye opener. It definitely helps. Like you said, the things that you didn't get accredited for, you know why, and what you need to do to make that next step. You know, overall, it's a good learning tool.
Okay.
You know, it's a constantly dynamic process. It's always changing. You know, in my view, I don't think it's ever going to end. I think there's always going to be a next step, add this, add that, because we're getting good results from that. And so if we can take it to the next level, let's take it to the next level.
Good. So you found it a growth opportunity?
Yes, absolutely.
Okay.
Absolutely.
All right.
Any situation where you know you're being evaluated by somebody, there's always a lot of stress and anxiety leading up to that point. But I think for us in particular, in our practice, we're pretty consistent about staying on top of the paperwork, staying on top of the credentialing, staying on top of, you know, meeting those criteria throughout the course of the year, which makes it that much easier when the validation process comes to be able to just kind of put the final pieces together and present it to somebody else. I think it is very helpful to have somebody come in from the outside who's unbiased, so to speak, and take a look at your practice and notice the things that you kind of take for granted after a while, that hey, you're really doing a great job here, but we'd like to see you improve on this area, and it kind of makes you realize, yeah, you know, they're right. And a lot of times the things that we think maybe we're not doing so great on, come to find out we're actually doing a lot better than what we thought.
Excellent.
Validation came in, and we were looking at, and we all felt very positive about it, like we knew we were going to do well, and as long as you keep up with everything, it's just like, you know, you're going to do fine. And it's interesting to see, you know, your perspective on what we're doing,
Right.
And where, you know, and what to improve on, like you said. Yeah.
Right.
So it's a great learning experience. You know,
Yes.
you're going to come away from this a better physician, a better practice, better staff. Everything is getting better.